We can start.
Let me just introduce you. Buenos días a todos por conectarse nuevamente en nuestra página Sai México. En esta ocasión tenemos esta sesión post-congreso que estamos organizando en conjunto con la Walter Dandy Neurosurgical Society con el tema del futuro de la educación neuroquirúrgica a cargo del doctor Aib Sherian, quien es director de neurociencias en el Instituto Krishna de Ciencias Médicas en Karad, Maharashtra, India. Um, Good morning, everyone. Welcome to this post-Congress session joined with UNESCO and Walter Dandy Neurosurgical Society. Today we have with us Dr. Aicherian, who is Director of Neurosciences at Krishna Institute of Medical Sciences, Korat, Maharashtra, India, with the topic The Future of Neurosurgical Education. Thank you very much, Doctor, for being here with us today. I'll give you the word.
Thank you very much. So, I will be talking today about the future of neurosurgical education. The future of neurosurgical education, to dwell on it, we must think what is the neurosurgical education that was in the past and what happened after that, and what is the present state of neurosurgical education. And we can go into future directions of neurosurgical education. The good news is that things are improving fast and things are improving logarithmically. It's not on a linear pattern, it's improving logarithmically. So the young neurosurgeons of today, they have a lot of hope that they don't have to spend a lifetime learning basic things in neurosurgery. So this is what I'm going to talk to you. So I'm going to share the screen right now. Are you able to see my screen? You're able to see my screen?
Yes, Doctor.
Yeah. So you can see this. Now, we're looking at the past. In the past, what was neurosurgical education? Of course, we had books, line diagrams, we had autopsies. The surgeons were not so interactive. Most surgeons, they developed their techniques and their team could probably learn what they developed, but interactions was very limited because internet and internet videos were not very popular. Introduction of the microscope and recording of surgeries, it completely changed things. And that has been one of the biggest developments in the last 50 years. However, these developments are still not really come to all the countries, and in low income or developing, so-called developing countries, neurosurgery is still an ancient science. Neurosurgeons don't really understand a lot about scientific or advanced neurosurgery, and the patients pay the price. For example, a 100-year-old surgery like decompressive hemicraniectomy is still being done in trauma, while there are better alternatives available. Lots of surgeries are done without the microscope in many centers. See, these are all examples of the past haunting us in the present. One other thing is the present scenario. Sometimes I feel the present scenario is one step behind. We equate in the present scenario, the number of publications that one has in popular, hallowed, peer-reviewed journals to be, the hallmark of a good neurosurgeon. This is not correct. So neurosurgery, like F1 racing or professional football, is a professional sport. Somebody who's well published in F1 racing is not necessarily the best driver. Someone who is well published in football is not necessarily the best footballer. I'm sure a club like Barcelona will never vie for the best published guy. They'll vie for the best footballer. Unfortunately, a well-published surgeon in the present generation carries a lot of value for the young neurosurgeon. But you must remember, it's not at the cost of not being good at neurosurgery. You could be published, but published is secondary. Primary thing is skills. And that's why sometimes I feel the present scenario in neurosurgery is probably a step behind. I mean, we see a lot of very well accomplished neurosurgeons who are well published, but getting into theater and doing a tumor or doing an aneurysm surgery is maybe they are not the best. So young neurosurgeons should understand the difference between these two. For a good neurosurgeon, there are a few things that are important. Physical fitness is important. A work-life balance is important. The ability to learn and unlearn is important. Strategic planning, avoiding panic, decision-making is important. One of the most important things is, of course, patience. Ability to lay emphasis on surgical skills, worshipping surgical skills is important. And obviously, mentorship and coaching is also important. So these are what gets a neurosurgeon to be graduating from boys to men. Of course, most of the young neurosurgeons are capable. As soon as you get your degree, you're capable of doing many things. But what separates the boys from men are these factors. Now, with the advent of Corona, for us a little bit before that, the online webinars, the online collective community has contributed a lot to neurosurgical knowledge. I'm sure in the future, virtual ORs and use of simulations will also contribute. Today's evolution of neurosurgery education is based a lot on online webinars, virtual ORs, and users simulations. Slowly, we at the Krishna, we are using all this. We have the virtual reality platform with the Oculus Quest, and we reconstruct these scans. We take the residents to a virtual environment. We also have the cadaver labs. As you can see, we have fellows from all over the world, and we try to discuss core concepts of skull-base vascular trauma, and then With cadaver labs, anastomosis trainings, we try and improve the skills for neurosurgeons. And I believe this is an important step towards training young fellows towards being a very good neurosurgeon. That is what we do. So we teach them the optimal use of microscope, navigation, drill, CUSA. And we also think that the present armamentorium of a neurosurgeon is not really equipped uh, to deal with a lot of things. So, for example, today we had a huge fibrous tumor, really fibrous and huge tumor in the medial sphenoid wing region. And we could take that out completely because we use something called a plasma knife. Of course, in the outside, we use the plasma knife so that there was absolutely no bleeding. And the tumor was debulked beautifully. The CUSA would have failed here because it was so fibrous and it was pretty vascular too. So the CUSA would have failed, and taking it out in a normal way would have taken us 12 hours plus, and with significant blood loss. But with the plasma knife, the debulking was pretty fast. So there's a lot of things that we are designing. We are designing. So we're designing a mechanical CUSA where the frequency can also be changed, and it can take out a lot of things. Water dissectors, debriders, endoscope holders. These are things which will define the future of a neurosurgical procedure, the way it's done. You can see how artificial intelligence, virtual reality with haptic simulation, these are going to decide the future also. You see, you can hold that. This is being done in Krishna. In our center, you can hold the scan and you can just walk into the scan. And you can see everything. If it's an angio, you can see from all angles. You can just move your head and see from all angles. You can see me doing that on the right side. You could just walk into these scans. And another thing is, of course, hybrid neurosurgery. As I told you about the new concepts that we have, and how these concepts are going to help us and also train these neurosurgeons. I believe the era of microscopes are gone. I believe this is an era of exoscopes, and that too, exoscopes which will combine navigation and neuromonitoring to see in virtual reality a tumor or an aneurysm. Before even you open the head, you can shift from virtual vision to real vision anytime you want. And so navigation will be gone, neurophysiology will be gone, and microscopes will be gone. It will be an exoscope with a virtual environment, not even a screen. It will be just a HUD, and you can sit and operate the way you want, seeing exactly what you're doing, where you are, and seeing what vessels are near you, seeing what vessels are behind you in virtual vision while you're still operating. So this is the hybrid surgery concept, where a group of engineers, entrepreneurs, designers, neurosurgeons will have a common ground to work with. And this is possible with not much money these days. You really don't need a company to come and establish a monopoly, and most of us will have to pay through the nose to just get that thing set up. I've done this before. I don't think it's a pragmatic thing. So we are designing something a lot of things. And we urge our young friends to start thinking about designing things instead of publishing so that you can do better neurosurgery. This is our course that's going to happen on March 20 and 21 of 2021. And we invite all of you to virtually participate in this meeting. Thank you very much.
Um, thank you. Thank you very much, Doctor, for this amazing presentation. I think this journey from the actual basic sciences like anatomy to the more complex procedures with high technology are not only interesting for us as medical students, but also necessary. I think most of the time we enter to the first year of medical school asking ourselves about why do I have to learn anatomy that thoroughly? And this is why how we understand that basics are always come along with more complex, sophisticated technological applications in the surgical or in the clinical field. Um, what would you say to the current medical students who are interested in neurosciences or in neurosurgery uh, to keep training, to keep learning more about these subjects?
Well, as they say, the child is the father of man. So medical students are at a much better, uh, I would say, dimension or to understand and progress. So once we get into neurosurgery, our views are still bit more. We develop a little bit of a tunnel vision. But as medical students, you guys, I mean, those guys who are medical students, they got a wide vision, and then you are the guys who can go ahead and improve neurosurgery. I mean, that's the way I look at it. So it doesn't necessarily have to, you don't have to start progressing after you become a neurosurgeon. I mean, the progress is much before.
That's amazing, Doctor. Another point that I'd like to ask you about is the interdisciplinarity that you were commenting before. Um, Most of the time, we need to work not only with other disciplines into the medical field, but also with engineers, with intellectual property specialists, in order to keep innovating, to keep this pacing into new advancements. How is this done from the undergraduate in the medical school?
Well, so there are many things that a medical student can go ahead and collaborate with. I mean, we are trying to facilitate this kind of platforms where the medical student actually can collaborate. So we're trying, but at Krishna, we're trying to get these medical students to involve in our projects. For example, we have these projects of, the cooling and cleaning of the brain. We propose that, uh, and we want it even when other medical students from all over the world, they are welcome to come and participate with us, collaborate with us. But we just started the department new, but so we are trying to make protocols and things. But I'm sure Salim and others who can guide you all around, they can tell you about projects that you can get involved into. And this is the time when you're a medical student, that is the time that you really have to go ahead and start something on your own, have an idea of your own, and then pursue it. And then that's the way to Nobel, you see.
Thank you very much, Doctor. We just got Dr. Salim Abdulraf into the session. Dr. Salim, welcome to this amazing joint session with Dr. Aib. Would you like to say some
Hey,
words?
Salim.
Hey, Ibe, good to see you. Good to have you with us. It's so cool good to see you after such a long time.
Good to see you, man. Good to see you, Salim.
Yeah, that's great. So have we started the session? Where are you now,
We just
Alejandro?
finished, Salim. No, we just finished, Salim.
We just finished?
No,
I am so sorry.
No, not at all. See, we were talking about the future of neurosurgery, and we were telling how important is virtual reality, amongst other things in the future of neurosurgery, plus new things. So,
show me.
Just you just say this one.
Yes.
And we designed an app where you could you need to have a pretty powerful computer though, but you could put in any scans, and there's a protocol for these scans. You could put in any scans. You could color any tumor into anything, or vessels just separate.
Love it.
You can fuse.
Yes.
You can fuse CT scans. So instead of seeing CT scans now on a screen, all our residents see the scans with this, and then it's just it is completely mind-blowing. You see, it's like you're walking inside the brain and you're seeing everything instead of just seeing a 2D picture.
So, I love the way you think. Listen, we are about to launch one of the largest educational programs in the world of neurosurgery, okay? And I want you to be, so we are really, we want to catch some of the pioneering, cutting edge neurosurgeons around the world to give some of the courses in this, okay? We're keeping all the politics out. We're not going to use the name of any society, okay? This is bigger than any society or any organization, okay? So this is why, by taking the name of the society out, we are making it neutral, all right? So it's this is going to be one of the most comprehensive educational systems ever launched in the field of neurosurgery, all right? So we are now going to be seeking, we have the core stuff, and then we have people who are going to do this elective stuff about technology, new things, and we're going to have participants from majority of countries in the world. So it's very, very big undertaking, okay? You're my friend, but I respect you for who you are as a neurosurgeon, in the thinking and all the thoughts you have about future technologies. So I'm going to want you to be in this journey with us, okay?
Yes, for sure, son, for sure.
And will take the politics out. We will not. So nobody says, well, it's named this, so I don't want to be. We will take that out, okay? Let's do it for the bigger reason, for the really, so that everybody can be involved and nobody feels like, that there's any political reasons, okay? So we will make sure that we will respect that process and not, limit anybody. And so I already had mentioned your name to the board. We were looking at names of a lot of people around the world. So your name is already on the list. So I think it will be really great, to have you with us.
I'll be honored, Salim. I'll be honored.
Yeah. How are you doing at the new institute, IPE? How are things going for you?
Well, we are really enjoying ourselves. So today we used the plasma knife to take out a huge medial sphenoid pink meningioma.
Nice.
I mean, my fellows were saying it's like a cadaveric dissection. We had absolutely no bleeding. Very vascular, very fibrous, huge tumor stuck to everything.
Right.
And the dissection time was literally nothing. The post-op scan is excellent.
Nice.
So, and we used a plasma knife. So we have designed something called a scoop, where it's like a QSA. It's a mechanical QSA, but we can change the frequency as well.
Nice.
So it's a mechanical actuator, unlike a piezoelectric crystal. So we are we are putting the world's first 192 slice CT scans project with Siemens. So we had an intraoperative 3 Tesla before, but now we understood that's useless. So we're putting this CT scan, and that too, we are converting a normal CT scan into an intraoperative CT scan, which will come 12 meters into your theater, scan, and then go back.
Nice. I love the way you think. I love the way you think. You're an innovative person. You're doing great work. I think this is great stuff. This is great stuff. And we want you on this journey with us, IPE, okay?
For sure, Salim, will be honored. And I want you to come down here. I want you to see all this.
I will, of course. I mean, once this COVID thing is done, I'm dying. I'm dying. The first time I traveled in 12 months was 2 weeks ago. I went to Europe for about 7 days. That's the first trip I made in 1 year. Remember, I used to travel 1 week every month somewhere in the world. Okay, so I just went to Europe for some of the board meetings and some board examinations. We had to get out of the way and so forth. But yes, I cannot wait. Once things are done, once I'm coming to your part of the world, I'm coming to visit you. There's no two ways about it, right? I mean, I'm coming. Yeah, of course. I'm going to come and see you. Let this crazy stuff settle down with the vaccinations and everything. And in the process, we're launching this thing within the next 2 or 3 months. I will be in touch with you. I want to really show you what we're doing here. It really will be transformative. It can really, and it's beyond all the politics between all organizations. Beyond, we don't want, that's a different thing. This is a totally different level. Okay, so I think it'll be great. It's so good to see you. And please stay in touch. Give my best to the family. Okay.
Yes. Thank you. Same. God bless.
God bless. God bless. Take care, buddy. All right. Thank you.
Doctors. See you soon.
Thank you, Alejandro. Okay, take care. All right. Bye-bye.
Toda la audiencia, muchísimas gracias por estar aquí con nosotros este día. Y pues les pedimos por favor se mantengan en contacto y al pendiente de nuestras redes sociales. Esta semana en Sain México vamos a tener distintas actividades, no solamente en conjunto con la Walter Dandy Neurosurgical Society, pero también en conjunto con Universum dentro de la Semana del Cerebro y por supuesto nuestros ciclos de conferencias mensuales. Muchísimas gracias a todos por estar al pendiente.